This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.
Hello, and welcome to Skincare Confidential, the podcast supporting the Science of Skincare Summit, an annual educational conference occurring September 5th through the 7th, 2025 in Austin, Texas. It is 7 o'clock in the morning in Austin, but much later than that in Seoul, South Korea. And I am so excited to introduce my guest today, who is Dr. Jihee Kim. Dr. Kim is a professor in the Department of Dermatology at Yonsei University in or around Seoul, South Korea. Dr. Kim has done some incredible work in dermatology, in particular combining topical dermocosmetics or cosmeceuticals with laser or energy-based procedures. And because of that, she has worked extensively with SkinCeuticals and has two abstracts that will be presented at the American Academy of Dermatology meeting in March of 2025. And we will be focusing on the results of those two abstracts. Dr. Kim, thank you so much for joining us.
Hi, Dr. Lain. It's so nice to be here, and I'm looking forward to our conversation today.
Wonderful. Well, let's jump into this, Dr. Kim, because you are such an expert and you've produced such amazing data. There were two abstracts that are being presented at the AAD. Interestingly, they are on the same group of patients. You treated the patients on their face with one type of treatment and on their neck with another, which I think is just brilliant because it really is efficient. Could you please go through this group of patients and just talk about the demographics of this study group?
So, our study looked at how combining microneedling or microneedle radio frequency with an antioxidant serum containing vitamin C, E, and ferulic acid could enhance skin rejuvenation. And we already know that microneedling is great for boosting collagen and improving skin texture. And also, CE-Ferulic is one of the most well-studied antioxidants to help the photo damage. But we wanted to see if using them together could create the kind of synergistic effect and basically whether the serum could enhance or even prolong the benefits of the treatment. And it turns out it really does. And how we recruited the patient is we treat the patients for the face, we did microneedling only, and for the neck, we did microneedling radio frequency. And we chose different methodology because I think many patients could use microneedle as a home care procedure instead of visiting the clinic every time. So we tried to use different modalities in the same patient group.
Well, that's brilliant, actually. So exactly correct, right? The microneedling procedure, we know that people can buy microneedle
Mhm,
rollers, for example, or
mhm.
microneedling stamps. They are readily available and can really do this at home on a regular basis. Just to back up, though, Dr. Kim, if you were talking with one of your patients who is interested in performing microneedling at home, how
Mhm.
frequently would you recommend them doing the procedure on themselves?
I would recommend repeating the procedure with at least 3 or 4 weeks apart because the home devices are usually 1 millimeter to up to 1.2 or 1.5, depending on the regulations. But if it's too frequent, it might harm the regular skin turnover the interval. So I would recommend a monthly treatment or somewhat longer than that.
Okay, great. And of course, because you are producing an injury in the skin and the needles are penetrating through the epidermis into the dermal layer,
Mhm.
you'll want to make sure that your skin is thoroughly cleansed before performing any procedure. And
Absolutely.
Yeah, and after you've used a microneedling roller or stamp, my recommendation, and Dr. Kim, I'm pretty sure you'll agree with me, is
Mm-hmm.
to throw that away because that is
Mm-hmm.
now not sterile at all, and reusing it could introduce infection, and so it's time to get another device for your next treatment, which I totally agree. 1 month, 4 to 6 weeks apart is probably the right interval. Dr. Kim, in your study with the microneedling on the face,
Mm-hmm.
how deep did the needles go with the microneedling device that you used?
So it varied from 1.2 millimeter to 1.5 millimeters. And because we were doing a procedure in a clinic, we did the procedure after applying the topical anesthetic cream. So we could have gone deeper, but we tried to stick in with a routine home care depth. So I used 1.2 to 1.5 millimeter.
Okay. Again, mimicking what a consumer can do at home. So
Mm-hmm.
so you did the procedure twice, Dr. Kim, right? At baseline
Yes, at
and then
baseline and
again
at 4 weeks.
4 weeks. Okay. And can you explain how the CE-Ferulic serum was applied?
So I've actually got an idea from the study by Dr. Weibel many years ago using
Uh-huh.
C-Ferulic after fractional CO2 laser. And because from her study, applying C-Ferulic after ablative laser procedure did not cause any erythema or irritation, we were quite confident that we could use immediately after the procedure. So in our clinical study, C-Ferulic was applied immediately after the microneedle procedure.
And it was a split face study, right, Dr. Kim?
Right, it was. So we randomized the split side of the face. So patient didn't know which side was getting the C-Ferulic and which side was getting the placebo because the placebo that we used was a exactly same formulation with C-Ferulic, just without the antioxidants. So one side, our clinical nurse coordinator applied C-Ferulic, and the other side, the placebo serum was applied.
Okay. And then the patient was instructed to continue application at home?
Yes, they used it once daily for 12 weeks.
Okay. Was the patient blinded as to what serum they were using on each side of their face?
Yes, so to be honest with you, like the placebo serum was a very good formulation. So some patients didn't recognize which one was the actual test product. So we were glad that the result turned out that the Ferulic has superior results. So I
Okay.
think it was well blinded.
Okay, good. And because your nurse coordinator performed the procedure and applied the first application of CE
Hmm.
Ferulic, the principal
Hmm.
investigator was blinded as well. I assume.
Yes, I was blinded. So In in our regulations, actually, it was me who performed the microneedle and for the face. So I moved out, and she continued the application, and then I went back to do the procedure for the neck.
Okay. So right. So remember we're talking about two different protocols on the
Right.
same patient, one on the
Mm-hmm.
face with the microneedling, one on the
Mm-hmm.
neck with the radiofrequency microneedling.
Right.
You performed the procedures, then
Mm-hmm.
you left the room, and the nurse coordinator applied the serums to the randomized side of the face that got active versus vehicle.
Exactly.
Okay. Okay. I'm understanding now. That's a really brilliant protocol development. Honestly, Dr. Kim, it's so efficient, and I think I'm going to use that.
Thank
um,
you for the compliment.
Absolutely. So the patients applied, you had two procedures. The patients applied the CE Ferulic from day zero through through week 4. Did they continue applying the CE Ferulic after week 4?
Yes, they did. So they
Okay.
continued applying up to 12 weeks, and it was used throughout the study.
And the primary efficacy endpoint was measured at 12 weeks?
Well, we had some different primary and secondary endpoints, but the
Okay.
main primary endpoint was at 12 weeks, and that was the modified Griffith scale. Yeah.
Okay. Okay. And can you explain the modified Griffith scale to our audience?
Mhm. The modified Griffith scale is one of the best used clinical scale to measure photo damage of the skin. It has attributes of fine wrinkles to coarse wrinkles and skin texture and skin tones. So it could address like various aging features such as pigmentations to skin roughness. So we recruited the patients showing mild to moderate degree of modified Griffith scale, and then we repeated the measurement at 4 weeks and 12 weeks.
Okay, great. And so you did the microneedling on the face, so we understand that procedure. Let's go to the neck. Before we get into the results
Mhm.
of both, I'm keeping everybody on the edge of their seat here.
Mhm.
But before we go to the results, let's talk about how you did the neck. So this was radio frequency microneedling. Do you
Right,
mind, Dr.
correct.
Kim, just explaining that procedure and how it differs from microneedling?
Mm. So the the applicator is basically the same, but the difference is when we use it for microneedling, we turn off the radio frequency energy and just use the microneedle itself. But when we use it at a microneedle radio frequency, we turn on the electricity on. So for the neck, we use the needle depth for 1.5 to 1.8 millimeters, and there were energy in every single microneedle pin, which was about 20 to 30 joules per pin. And it was done by a stamping procedure with a single overlapping passes.
Okay, great. So now we understand. On the face, no radio frequency energy was applied through the needles. The
Mm,
exact same needles were used on the neck, going a little bit deeper with
mhm,
radio frequency energy applied.
exactly.
And Dr. Kim, can you explain to us why are we using radio frequency energy with microneedling? I suppose what goal are we trying to achieve with the radio frequency
Mhm.
microneedling?
That's a great question because the neck wrinkles are rather coarser than the facial fine wrinkles. And we could still use microneedle for the neck, but still we wanted a slight difference because for the neck, we tried to have a deeper collagen stimulation and regeneration of elastic fiber. So by using microneedle radio frequency, we could deliver the radio frequency energy directly to the dermal level, and we could bypass the epidermis, which has a higher risk of post-inflammatory hyperpigmentation or burns. So I think microneedle radio frequency is one of the efficient methods to treat the collagen remodeling and also enhance elasticity.
All of your patients in the study were Korean, correct?
Right. So
Okay.
they were 28 patients and they were all Koreans.
And, it's well known that people of Asian descent have skin that can react to energy based devices or even non energy based devices
Mm-hmm.
differently than people of Caucasian descent or African
Mm-hmm.
American descent, for example. So, in my training, at least, we were trained to be
Mm-hmm.
very careful with people of Asian descent with
Mm-hmm.
their skin. Was there any pre-treatment that was performed for this study in terms of did you pre-treat with hydroquinone or anything that
Uh-huh.
that might help reduce the occurrence of hyperpigmentation with these treatments?
So that's a very good point because if it was not a clinical study, I would routinely prescribe patients for pre-treatment before any kind of procedure. But because this was a clinical study, we had to ask them to stop using any active ingredients or even retinoids for 2 or 3 months before the study. So in this study, there were no pre-treatment.
Okay. So there was no pre-treatment, and as you said, in your clinic on a regular basis, you would pre-treat to prevent hyperpigmentation.
Yes, I do.
So we haven't used anything to prevent hyperpigmentation. And pigmentation is part of the Griffith scale, as you mentioned.
Yep, agree.
So now's the time where I think we should start talking about the results, right? Because I
Mm-hmm.
think they're actually kind of incredible. So let's talk about the face first, Dr. Kim. Okay.
Mm-hmm.
So can you review the results of the facial treatment with the two microneedling treatments? Remember, they were performed at baseline in week 4, and
Correct.
there was a split face application of
Mm-hmm.
CE-Ferulic that was used immediately after the procedure at baseline, daily by the patient until week
Mm-hmm.
4, procedure performed again,
Mm-hmm.
CE-Ferulic applied immediately after the procedure again at week 4, and then
Correct.
daily through week 12. So we've set the stage. I think everybody understands who these patients are, what you did, and let's
Mm-hmm.
go through the results if you don't mind.
So if I start from the microneedle phase study,
Yes.
so starting from 4 weeks, the CE-Ferulic treated site showed increase in skin elasticity. And the way we measure it is there is a device called skin elastometer, which is a device used to measure the skin resilience by the elasticity values, and that difference kept increasing by week 12, and the difference was statistically significant at the point starting from the week 4 and also at the week 12. And another interesting result was there were some difference in the skin melanin levels from the microneedling. So after 12 weeks, the level of melanin content measured by mixameter showed decrease on the facials on the side treated with zeoferulic.
And on the side not treated with CE-Ferulic, did the melanin index increase compared to baseline at week 12?
It slightly increased because we were getting into the summer when we
Ah,
were almost completing the study. So
yeah.
there was a slight increase, but it was not significant. However, the
Okay.
difference between the C-Ferulic treated group and non-treated group showed some significant difference.
Okay. So just to summarize, we
Hmm.
saw an increased elasticity of the skin measured objectively
Yep,
with a cutometer, and that was not only increased at week 4 after one
yep.
treatment, at week 8 after 2 treatments, and
Hmm.
continued to increase at week 12. Am I correct?
Yep, that was also very interesting for us because we do expect like there should be increase at week 4 because both sides were treated with microneedle. But the difference between the Ferulic treated site and placebo site, there was significant difference between two sites. So in general, it was increased overall because we did the microneedling procedure, but the gap between two groups were further increased in the Ferulic site.
And that's it right there. Right? That's the whole purpose of the study, is
Yep.
to show that you can augment the results of a treatment to the face like microneedling with the use of integrated skincare. And the only
Hmm.
product used was CE-Ferulic, which is a combination of 3 very strong antioxidants, right, Dr. Kim?
Hmm.
Vitamin C,
Exactly.
vitamin
Yep.
E, and
Hmm.
ferulic acid,
Yep.
all developed by under the Sheldon Pinnell
Hmm.
Duke parameters, that where he found the correct percentage of the antioxidants in the correct
Hmm.
acidic buffer so that they were the most biologically active. And I think we should talk a little bit about the product itself, Dr. Kim, because
Hmm.
it is acidic, right?
Yep, it is acidic, and people are very concerned about whether it could be irritating by applying immediately after the procedure. But so when we first applied the serum, we kept the patients in the clinic for up to 30 minutes to see if they are really okay.
Mm-hmm.
But the C-Ferulic applied site didn't show any sign of irritation or prolonged erythema. So it was considered safe using as immediate application post-procedurally.
This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.
Dr. Kim, besides the vehicle and the CE-Ferulic, were any
Hmm.
other products applied to the face?
Well, we use the Dolarium moisturizer by La Roche-Posay, which was supported by the Korean SkinCeuticals teams.
Okay.
So from the sunscreen and skin cleansers and even the moisturizer were all controlled for the placebo and C-Ferulic site.
Okay, so the patients used either vehicle or CE-Ferulic to one side of the face, but the
Okay.
moisturizer, sunscreen, cleanser was the same for both sides of the face.
Exactly.
Okay. Now we also mentioned the Griffith scale, Dr. Kim. Can
hmm
you review just the results of the Griffith scale that you used at baseline in week 4, 8, and 12?
So we use the overall photo damage scale for the modified Griffith scale, and we are still analyzing the features from each attributes. But when
Oh,
we
okay.
add up the whole score, the the modified Griffith scale, which scored higher in the baseline, showed
Uh-huh.
decrease after 12 weeks, and the difference between two groups, C-Ferulic and placebo, were also significantly different. So C-Ferulic
Okay.
side showed further decrease in modified Griffith scale.
Okay. Okay, amazing. So, just to reiterate, before we go to the neck, because this is truly an amazing study, the more I learn about it, the more I'm impressed. There was no pretreatment for these patients who have a
hmm
risk of hyperpigmentation anyway because of their skin type and because of the treatment that was being used. So it was gutsy to do this without pretreatment, right?
Yeah,
Um, Two treatments were done between 1 to 1.2, I believe, millimeters in depth with the microneedling device.
exactly.
Split face comparison, vehicle versus CE-Ferulic. That was the only active that was used on the skin. The rest were bland moisturizers, sunscreen, and cleansers.
Exactly.
Patients used the skincare through 12 weeks, even though there were only two treatments done at baseline in week 4. And what you
Agree.
found was the elastic component to the skin improved, the elasticity of the skin improved, not only compared to baseline in both sides, which is not
hmm
surprising, right? You
Yeah.
would imagine
Right, right.
microneedling would improve elasticity
hmm
by itself. So that's totally not surprising and expected.
hmm
But what is maybe not surprising, but it may engender some raising of eyebrows from our listeners to know that the CE-Ferulic applied to one
hmm
side actually increased elasticity through week 12
hmm
compared to the vehicle. Both sides got microneedling, but the CE-Ferulic improved elasticity statistically significantly greater
hmm
than the vehicle side. And we are anxiously awaiting the results of the modified Griffith scale on photoaging, which I'm
hmm
sure will be published, to see which of those attributes also improved with the CE-Ferulic side versus a vehicle in a statistically significant manner. Is that fair?
Yeah, that's fair. And actually, I was quite surprised because, like, as you mentioned before, like, because we did the very powerful treatment, microneedle and microneedle RF, it is very natural and expected to see increase in skin elasticity, but the sustained increase was very interesting for us. And what I also want to mention is from the study on the neck, I think it it is very well demonstrated because on the study from the neck, the skin elasticity increased at 4 weeks, but it started to decrease from 8 weeks on the placebo side.
Mm.
However, on the C-Ferulic treated side, there were sustained increase up to 12 weeks. But still, comparing baseline and 12 weeks, the overall values are increased in both groups. But in this placebo group, there was a the peak at 4 weeks, but which become toward the down point after the treatment effect was gone, but still C-Ferulic could induce sustained increase in skin elastic fiber.
Great. Thank you for that segue. Let's talk about the neck now. I think
hmm
we've kind of completed our analysis of the study microneedling to the face. Let's talk about microneedling, radiofrequency microneedling to the
hmm
neck. So, a much different procedure, honestly, because of the application of that energy, which is applied, as you mentioned, to the dermal layer, the deep dermal
hmm
layer. And not only does it enhance the effect of the microneedling in my experience, but it also can cause some tightening of the fascia, for example, and
Aha.
just a reformulation of the collagen to be much younger in its activity. So I'm as a more aggressive procedure where the procedure probably does more by itself than microneedling. I wondered how much effect CE-Ferulic would have with the procedure that does a lot by itself. And indeed, as you mentioned,
Mhm.
the CE-Ferulic as an integrated skincare is absolutely synergistic with this procedure.
That's a very critical point because the way we set the energy G point for the microneedle radio frequency is considered moderate or even slightly lower than the moderate values. But
Mm-hmm.
because we didn't do any pre-procedural skincare, we tried to go for rather safe and moderate procedure protocols. So the depth-wise, 1.5 to 1.8 millimeter is rather usual parameter used for neck rejuvenation.
Mm-hmm.
However, the energy level was somewhat in the intermediate, 20 to 30 joules depending on the skin type. It
Mm-hmm.
is not considered as the most aggressive parameter. But because I was treating the patients with the Fitzpatrick skin type 3 or even 4, I had to be more careful using a higher energy level.
Mm-hmm.
And to address to your point on the fascia tightening, I wish I could achieve the deeper level of skin tightening with the procedure. However, I think the fractional microneedle radio frequency, it might be a little bit difficult to achieve deeper penetration on the neck because the neck is not a very stiff anatomical structure compared to the face. So when we do the procedure, there is some kind of repelling back of the needles. So there's always a risk of the focused electrical damage on the epidermal side. So
Mm.
that was the reason why we had to use the moderate parameters for the neck. But I totally agree with your point. So probably like combining CE-Ferulic with maybe monopolar radio frequency or bipolar radio frequency with a high energy would be very interesting result.
Okay. And you, it's the same idea, CE Ferulic to
Hmm.
one side of the neck, vehicle to the other side of the neck, once daily for 12 weeks, 2 treatments of baseline in week 4.
Hmm.
And let's go through the results just for the neck now. And I think you mentioned this before, but the elastometer measurement of elasticity of the skin was
Yeah,
significant, not only compared to baseline, but
yeah,
actually between the two sides, right?
yeah, correct. And on the placebo side, there was some decreasing trend after 4 weeks,
4 weeks.
but there were
Yeah.
sustained increase on the Z-Ferulic side.
And I mean, elasticity of the skin on the neck is so important, right? Because so many of our patients come in complaining of sagging of the neck, deepening of the horizontal lines of the neck. And so if we can
Agree.
use a product like CE Ferulic, which
Agree.
is, it's so easy to apply
Mm,
and enhance elasticity, that is incredible in and of
agree.
itself. And then let's talk about the mexameter ratings in terms of pigmentation.
So for the neck, we didn't have any interesting data on mexameter. There were no
Okay.
difference between the placebo and C-Ferulic group. Yeah,
Okay, great. So it certainly didn't cause hyperpigmentation, which again
it
is something
didn't.
I would be worried about with the
Hmm.
addition of the energy.
Right.
So really important to talk about that in my view, and then as we think about the modified Griffith scale again, I'm assuming those data are not available yet.
So we tried to apply modified Griffith scale, but
Oh,
because it has pigmentation component, we thought
uh-huh.
it was not one of the most appropriate scales maybe for the neck rejuvenation. So instead, we did the investigator rating. I didn't, including me, there was 3 independent dermatologists who
Okay,
measured the clinical grading in five scales like maximum improvement, moderate improvement.
okay,
And there were some statistical difference between the C-Ferulic and placebo group, but still, I think the measurement data seems more interesting for the poster presentation. But it is
got it.
also
Okay.
included in the results.
Okay. Okay, great. So the elasticity of the skin is really what we're focusing on here. And
Mhm.
if we think about the mechanism of action of CE ferulic as a strong antioxidant, how can we make that leap between preventing reactive oxygen
Mm-hmm.
species damage and enhanced elasticity or enhanced elastin production in the skin? How, in your mind, how do you make that connection?
So before the study, I myself was even more focusing on the collagen as a thermal rejuvenation.
Mm-hmm.
But I think from our study, we could have like a slight shift from collagen to elastic fiber because collagen acts as a main structural protein and it could be rejuvenated by procedure itself.
Mm-hmm.
However, the regeneration of elastic fibers are quite less compared to collagen after the procedural change. And if we look into the product a little bit, I think the antioxidant, the vitamin C itself, could promote collagen synthesis by providing the scaffold by the vitamin C. And the vitamin E and ferulic acid could help with the elastic fiber because it could reduce the oxidation of elastic fiber and degradation. So probably by using a combination antioxidant could enhance the elastic fiber regeneration, which was first stimulated by the procedure, and probably applying it regularly could enhance the production of elastic fiber after even the procedural effect is done.
So you're really taking the biology of vitamin C and the way vitamin E and ferulic acid work synergistically with vitamin C and applying it to not only the effect on collagen, but also the idea that the collagen can act as a scaffold for elastin to grow, which
Agreed.
Dr. Kim, I think that's brilliant as well. I never thought of it that way. So thank you for that. I always learn something when I speak with Dr. Kim. So
Thank you very
we
much.
have unbelievably run out of time already,
Hmm.
Dr. Kim, but I just want to thank you so much, not only for walking us through the data, but also having the idea to perform these studies and developing such an interesting protocol for both the
Hmm.
neck and the face, and really showing the power of integrated skincare. I think we talk about it a lot, and there
Hmm.
are studies on it, but this is such a well-controlled, well-performed study with really significant objective grading that's used as primary endpoints, along with subjective photo damage scales and IGA scoring. But when you see this objective data, you really cannot argue with the fact that the CE-Ferulic
Hmm.
application after both microneedling and radiofrequency microneedling
Hmm.
enhances the efficacy of these procedures. So
Hmm.
thank you again, Dr. Kim. I look forward to seeing you perhaps at the AAD. Will you be there?
Unfortunately, not for this year, but I'll try
Oh,
to attend
no.
the next year.
Okay. Okay. Well, we will miss you, but certainly your data will be presented, and that's incredibly important.
Hmm.
My name is Dr. Ted Lain. I am your host for today's episode of Skincare Confidential. I would like to thank my guest, Dr. Jihee Kim from South Korea. Please, if you like the episode, give us a 5-star rating, subscribe, and please tell your friends about the podcast as well. Thank you so much.
This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.